My name is Marissa Brower. I'm a veterinarian at Cedar County Veterinary Services in Yankton. This is Kuma. He is Shiba Inu, and this is his mom, Amanda, who is my technician. So we're going to talk about some simple first aid treatments that you can do when you're out with your dog, especially out hunting. We see a lot of dogs that will end up scratching their eye or getting what we call a grass on or a grass seed actually into their eye. So usually one of the first symptoms you'll see is your pet will start pawing at their face, or they'll be squinting, holding the eyes shut. So you can pick up just at the store, you can pick up just an eye flush and keep it in a bag, some cotton balls, and then just an artificial tear that just helps lubricate. You're not going to want to use anything like Visine that has antihistamine. I use Sustain, Genteel Gel, any type of artificial tear that's just going to help moisturize that eye. So if your pet would have squinting, holding the eye shut, what you would do is you would take your eye wash. A lot of times I'm going to put the cotton ball right below the eye. We'll turn him this way. And then you're just going to flush. I always tell people the solution to pollution's dilution. So the more you flush that eye out, the better it's going to feel. Sometimes if you put a little bit of pressure, so if you put a little digital pressure up on the upper part of the eye, you can actually push that third eyelid up, and sometimes that grass seed will come out. If that grass seed doesn't come out on its own, I tell people as soon as you can get into your veterinarian, we can put a little topical anesthetic in there, we can reach down and grab it. But if it's left in there, it can really irritate the eye, and it can create what we call an ulcer, which is just an abrasion on that eye. If the dog is comfortable, you can put your artificial drop tears in there. I tell people usually every 4 to 6 hours, I'll put a drop in there. You can put it in more frequently, but what that will do is help kind of soothe that eye, get it more comfortable. But if you're not seeing significant improvement within the first few hours, or the eye's getting worse, or definitely if you're not seeing improvement within the first 24 hours, definitely want to get in. I tell people, the other thing we commonly see is when dogs are out hunting and running, especially through the grasses, just getting cut on a piece of wood or hitting barbed wire fence. We see a lot of lacerations or cuts on the lower legs. We sometimes see it on the chest. One of the best ways to protect the chest is a hunting vest. So it kind of covers and protects that area, but you still unfortunately have those legs exposed. If you do have a dog that gets cut, say you don't have anything with you, just water from a water bottle, just flush that wound out as much as you can. If you do carry something, a lot of times we'll tell people just a Neosporin, triple antibiotic ointment, even just plain old Vaseline, just fill that wound with it, and then you can apply a wrap. So you can put just a Telfa pad over the wound. And if you don't have it, you just use what you have. But we'll just pretend that he's got a laceration on his lower leg. So, and he's a really good patient, and most of the hunting dogs are going to be really good for their owners. So what you do after you flush and wash it out, you're gonna put that Telfa pad on, then you're just going to take some cotton, just wrap it around. You're doing so good. A lot of times I will also just put some brown gauze. If you don't have that, just use what you have, but just something to cover it, keep it moist. If we can keep those edges moist, then we can keep the tissue from dying. And then we just take your vet wrap, and then you certainly just can get it covered up. Sometimes you do end up with cuts up in the armpit, which it's almost impossible to wrap. You can do kind of a brownie badge or throw a t-shirt on them. Otherwise, I tell people just rinse it out really good and keep Vaseline in there. Just put big globs of Vaseline, and then just get a hold of your veterinarian, get him in and get the stitches put in there. A lot of times they're gonna go on an antibiotic also.